Good afternoon. My name is Marla McGinnis, and I will be your moderator for today's media availability. Before we begin, I'd like to introduce Dr. Robert Strang, Nova Scotia's Chief Medical Officer of Health, and Dr. Shelley Deeks, Nova Scotia's Deputy Chief Medical Officer of Health. I'll turn it over now to Dr. Strang, who will start us off with some brief opening remarks. Go ahead, Dr. Strang.
Thank you, Marla. Good afternoon, everyone. This week's data report, which has just been released, shows that we're still very much in an upward trend on our PCR positive tests, hospitalizations, and deaths. This, frankly, is not a surprise. I did mention last week that we were reasonably confident that this current surge has been driven, at least in part, by the current and highly contagious BA2 variant, and we're even more certain of that now. Yesterday, we received our latest results back from the National Lab, showing that about a third of the samples submitted from mid-March were a BA2 variant. So as Dr. Teresa Tam said earlier this week, it's clear Canada is in a sixth wave, and we're no different here in Nova Scotia. Case numbers have been high for the last few weeks. It's certainly an indication that the pandemic is not over. And we do need to use the tools that we have available to manage the spread of the virus and keep each other safe. Especially now that we are at such high levels of viral activity. We're about to head into a holiday weekend, and for many Nova Scotians, that means gathering with family and friends, whether it's to mark Easter, Ramadan, or Passover. But whatever you're celebrating this weekend, given where we're at and the amount of COVID that's around us, it's critically important that people still remember that follow the COVID safety protocols and gather in a safe manner, especially understanding who amongst them in their gathering may be in one of the groups that is at higher risk of severe disease. So we certainly know that it's important that people get vaccinated. That is giving us a strong layer of protection for ourselves and each other. But we do know that there are still a lot of people especially the adults in the 18 to 50-year-old age group who have not yet booked a booster. And I urge you to do that now. Yesterday, the National Advisory Committee of Immunization strengthened their recommendation for adults to get booster dose, a third dose of vaccine or their initial booster dose, with the evolving evidence of the importance of that. If you look at this week's report, that third dose of vaccine lowers somebody's risk of hospitalization by more than 83% compared to those who have had no vaccine or only one dose. And when you look at deaths, the risk of death is decreased by 91% when you look at those with 3 doses of vaccine versus 1 or none. So the third dose is not just a nice to do. It's a critically important part of making sure you're fully up to date with COVID-19 vaccine. So I want to point out that this week's report covers a 6-day period instead of the 7-day period we've used in the 2 previous reports. And that's simply because we're moving from a Tuesday to a Monday reporting period to give our epidemiologists and our data people more time to gather, validate, and analyze the numbers. The weekly report will still come out on Thursdays, but the shift means that a direct week-to-week comparison isn't going to be accurate for this week or next week, because this week the numbers you're comparing 6 days to the prior 7 days, and then next week it'll be comparing the 7 days to the prior 6 days. What's most important is that people look at the trends that are in the graphs on the trend, or what we call the epidemiologic curves. Those are the ones that really are the most important to say where are we at with this current wave of COVID. We've also added a new table to the report, one that presents COVID-19 hospitalizations and deaths during the Omicron wave, and now this new 6th wave by age group. And there may be some more changes to come as we get more into the 6th wave and have more data and start to separate the the Omicron or the fifth wave from the current sixth wave. These kind of adjustments should not be a surprise. They're especially they're common, and as we in any new report that is based on an evolving situation, we always look to improve that report. But certainly my commitment, it's important to me to make Nova Scotians allow them to have access to the information that we look at in public health in the same time frame that we get that. So we'll open to questions now, and I have asked, like last week, the Deputy Chief Medical Officer of Health, Dr. Shelley Deeks, to join me to answer any more detailed questions you may have on the data or on very specific vaccine questions.
Thank you, Dr. Strang. We'll now start with questions. We'll begin with Pamela Berman with CBC. Go ahead, Pam.
Given that how important vaccines are, can you tell us anything about the fourth booster that's supposed to be rolling out? I see no information on the website. I'm just wondering, can people book those now?
We're working on implementing that into our single data system, and will be much more coming out for the public on that next week on how people can start to then, people 70 and above living in communities as well as long-term care facilities, how they will start to be able to get access and book appointments for vaccine.
Pam, do you have a follow-up question?
Yes, I do. On the release of data, people are kind of trying to figure this out on their own a lot, depending on their circumstances. And you've mentioned that the data will be changing and coming out. But when I read it, it says the data will be released weekly until April 28th. Are we still going to get weekly data after that, or would it go to monthly? I just find that the people are really relying on information and would like more, not less.
Until we're well out of this wave, but we will certainly be looking to produce a weekly epidemiologic report.
Next, we'll go to CTV, Kyle Moore. Go ahead, Kyle.
Thank you. We've seen two Mi'kmaq communities here in Cape Breton shut down schools because of staffing shortages due to COVID. So as we see cases, rise, how concerning is it that these schools are shutting down?
So our objective has always been to, as much as possible, have kids, children and youth in schools for in-person learning. But there's always the possibility of specific circumstances in a community that may impact a local school. And certainly my understanding, it was really for operational reasons within those schools and those communities that led to the closure.
Kyle, do you have a follow-up question?
No, I'm good, thanks.
Perfect. Let's move on to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, there have been concerns, still on the school theme, there have been concerns expressed on social media by parents about the lack of proper supervision in schools for young children because so many staff are off, and we've heard from the teachers union this week about their concerns in terms of what they consider a huge impact of COVID on schools. I mean, is this are you getting this message as well from parents and from the union, and is it something that you can comment on?
No, that really is a question about the operational running of schools. I know those questions don't come to me. My responsibility is public health objectives and concerns, and so those your questions would be best directed to the Department of Education.
John, do you have a follow-up question?
I do, and again, it's for Dr. Strang. A pediatric infectious disease researcher told me this week he's a bit concerned about the level of immunization among the 5 to 11-year-old range. He thought it was about 80%. Can you clarify the number and comment on whether you expect to see it increase?
We certainly, I don't have the latest number in front of me. I believe we're in our 70% range of the 5 to 11-year-olds with their first dose, and about half of them having their second dose. So there's still a lot of work we need to do, and that continues to be a focus of our immunization program, making sure that all age groups have the right information and have access, so they can have an up-to-date immunization, with the right number of doses based on their age group and health condition.
Next,
Dr. Strang, it's Dr. Deeks here. I do have the numbers in front of me, so if it's helpful. The first dose coverage currently in Nova Scotia is 74%, and the second dose coverage for 5 to 11s is 47%. What we're seeing in Nova Scotia is common to what is happening across the country, in that we are seeing lower uptake in 5 to 11 people in that age group than we are in older children and young adults. And we expected that from the surveys that were done before vaccine was licensed in this age group. They indicated that there were more parents that were hesitant to give their children of this age group vaccine. So we still have a ways to go to increase coverage in that age group.
thank you, Dr. Deeks. Next, we'll go to Eilish Bonig with Global. Go ahead, Eilish.
Thank you there, Marla. My question also is on the school front here as well, too. So obviously, the decision was made to have students continue to wear masks. Some businesses are maintaining their own version of COVID protocols as well. So do you think it was a premature move to remove the mandates given the high number of weekly cases that we're continuing to see?
So public health has always recommended, and we continue to strongly recommend, that people wear masks in indoor public places and workplaces, whether there's a mandate or not. I can't comment on the decision that's been made by elected government on removing the mandate, but a very clear recommendation from myself and from public health that people continue to wear masks where previously they would have been required to wear masks.
Eilish, do you have a follow-up question?
Thank you. I do. Dr. Strang, aside from, what we're continuing to hear of, there's a high amount of virus in the community, what, if anything, do these numbers tell you, aside from that, of any significance?
So I think there's three key things out of this report. Not really no different from last week's report. We have, we're in a significant wave in the midst of that. Lots of virus around, but we, not to diminish any individual with severe disease or anybody who's actually died of COVID. But actually, if you look at our overall number of cases, we have a lower percentage of people who are infected getting severely ill or dying than at any previous wave. So that speaks to the third point about the critically important role that vaccine is playing in protecting us and minimizing severe disease. But it still means that we all have to, with all this virus around, we need to all continue to be cautious and careful and follow those personal measures that, even if we're not ourselves at risk, there are maybe others around us that we don't even know about that are relying on us to protect them.
Next, we'll go to Lindsay Armstrong with the Canadian Press. Go ahead, Lindsay.
Thank you, Marla. Dr. Strang, I understand there are 613 Nova Scotia health staff off work due to COVID. I'm hearing from health workers that the pressures on the hospital system are quite intense. At what point does public health policy adjust to react to what's happening in our health system?
So that really is, really an ongoing discussion with colleagues in the health system. And as I said last week, we continue to recommend a variety of measures that happen. It's really up to the colleagues in the healthcare system for them to be clear to government and to the Department of Health and Wellness that they need additional measures to help them deal with the situation that they're in right now.
Lindsay, do you have a follow-up question?
Yes, thank you. I'm wondering, Dr. Strang, if you can elaborate on that a little bit. What type of call or request should the health authority be making to get the support it needs? What do you mean by that?
That elected government has made a number of decisions on the public health measures that we have used in the past, and if it's really felt that we need to go back to looking at those, then it's really important that my colleagues in the healthcare system are at the table requesting those type of measures.
Next, we'll go to Tim Bousquet with the Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, I'm told that the lab won't be processing PCR tests over the long holiday weekend. Is that true? And if so, will people just have to wait that much longer in self-isolation before they know?
We were on a call this morning with our lab about how we continue to deal with the volume of the testing volume. There was nothing at all mentioned about them. I don't believe that's at all true that they're going to stand down their testing. They haven't stood down testing for close to 2 years.
Okay, thank you. And just in terms of the mask mandate, you've been pretty forthright about people should protect themselves. It's wide open otherwise. Vulnerable people cannot go to bars, restaurants, and so forth, but they really don't have much of a choice in terms of going to the grocery store and taking the bus. And you say you highly recommend people wear masks in such situations, but if you're a cancer survivor or whatever, and you have to take the bus and half the people on the bus aren't wearing masks, it doesn't seem like you can do much to protect yourself. So why not leave the mask mandate in place for those sort of essential indoor places?
So I strongly recommend that people continue to wear masks. It is elected government, not myself as a public health official, that makes those kind of policy decisions.
Next, we'll go to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, thank you. We're always seeing the data for hospitalizations and deaths. I would like to know, do we have data for people that have been diagnosed with having long-term COVID?
There's a lot of research going on across the country around what exactly is what's called long COVID over different time periods. There are some estimates of the percentage of people who have persistent symptoms, but there's not yet a clear diagnosis of what actually constitutes prolonged symptoms from COVID. So it really is in a research realm right now to understand this issue better. So we don't have any clear until we get better research with clearer definitions. We don't have a true understanding of this. It's like any new disease. Our knowledge of that disease, especially longer term impacts, will evolve over time.
Lois Ann, do you have a follow-up question?
Yes. My follow-up question is, in the province of Nova Scotia, do we have specific long COVID clinics available for people?
I haven't been involved directly in discussions. My understanding is there have been discussions within the health authority who are responsible for delivering healthcare services about opportunities. How certainly said there are some people who have prolonged symptoms that need ongoing clinical support and how best to potentially do that. But I think you'd have to ask the health authority more directly on that to get a more detailed answer on where they might be with that.
Next, we'll go to Pat Healy with the Laker. Go ahead, Pat.
Hi. Dr. Strang, with proms and graduations just a bit more than a month and a half away and the masks in schools extended to May 20th, because they're school-related activities, could it be possible that those events may have to have masks on during those events?
So that certainly is a possibility. We'll have to continue to monitor the situation, work with our colleagues in education, and give public health recommendations. I will say that the decision to continue masks until at least until the third week in May was really a decision made by the Department of Education based on operational issues that they could foresee over the next few weeks and doing what they needed from an operational perspective to have as many students and teachers in class.
Pat, do you have a follow-up question?
Yes, I do. For the immunocompromised and elderly, what would you say is a safe amount of time to spend in a grocery store with limited masking?
So I don't think there's any specific number on that. I think making sure that if they are going, that they go for the shortest possible period of time. Make sure they are masked, but also if they're really at high risk, then if there are other alternatives, whether it's getting somebody else to go grocery shopping for them. A number of grocery stores now have curbside pickup those are also safer options.
That's all the time we have for questions today. Apologies to the reporters we weren't able to get to. Thank you, Dr. Strang and Dr. Deeks, and we will see you next time.
Thank you, Marla.